Hello and welcome to Spotlight right here on S24 television. Today we bring you a conversation about healthcare, but not just medicine. We're talking about leadership, we're talking about innovation, we're talking about entrepreneurship and the challenge of building a world-class specialist hospital in Nigeria. Our guests are not only medical professionals, they're also partners in life and partners in transforming orthopedic care. That's an interesting one. One is a healthcare management executive and entrepreneur with years of experience in hospital administration, strategy, health insurance, and medical tourism. The other is a renowned orthopedic and joint replacement surgeon whose career has been dedicated to restoring mobility and improving quality of life through advanced surgical care. Together, they founded Paris Orthocare in Abuja with an ambitious goal to prove that Nigerians should not always have to travel abroad for quality orthopedic treatment, but building a specialist healthcare institution in Nigeria comes with difficult questions. Can private hospitals remain affordable? Why do thousands of Nigerians still seek treatment overseas? What is preventing Nigerians from becoming a destination for medical excellence? And what must change for patients to trust and access quality healthcare at home? Joining us today are the founder and CEO of Paris Orthocare, Dr. Priti Chawhan, a consultant orthopedic, of course, and joint replacement surgeon, and Dr. Rajiv Kumar. Welcome, both of you, to Spotlight On.
Thank you.
Welcome to S24 studio. Good to have you.
Thank you.
So let's before talking about, the business, let's know you first. Let's, talk about who you are before Paris Orthocare, before Nigerians. Tell us about yourself. Let's start with Dr. Priti. Ladies first.
Sure. Yeah, sure. Thank you so much for inviting us here and giving us this platform where we can create more awareness about the healthcare and how healthcare is in Nigeria. So first of all, talking about me, I'm a healthcare professional. I am into hospital management and healthcare services for almost 20 decades. So I have worked in India and abroad, and I have seen various challenges in Indian hospitals, or what are the beauty of Indian hospitals and how we can improvise in the healthcare which is here. So that's our concern, and that's our whole soul motive and vision towards setting this Paris Orthocare here in Nigeria. So we have been working in different specialities, different sectors, be it insurance, be it hospital management, be it strategic planning. So that's what I'm all about.
I'm still with Dr. Priti. What first attracted you to healthcare management rather than, clinical practice?
See, some sectors, they need reforms from the strategic point of view. Working as a healthcare professional, of course, it is the building stone of something. So you're building something upon that. But when you want to make certain changes from a strategic point of view, you need to be into a management profile where you can convert policies, you can make policies, you can make strategic changes which impacts more lives. And it is, once the policy is correct, the strategy is right, and you are implementing something in the right direction, you can do all the necessary follow-ups after that, like whatever you want to build, how you want your systems to be. So first system, and thereafter all these practices, everything that falls in place. So it has always attracted me. I have always been a management person, and that is what my strength is. I like managing, I like strategizing and planning and implementation. That's my strength. So I believe this impacts more people, and it is good in terms of creating things.
Good. One last question before we move to Dr. Rajiv. What inspired you to become an orthopedic surgeon?
I am not an orthopedic surgeon.
Okay, this is for Dr. Rajiv. Okay, Dr. Rajiv, what actually inspired you to become an orthopedic surgeon?
Yeah, since I was in medical professional, once I did my MBBS, I found I have very good inclination when it comes to the bone and joints. The surgery is such an area, not everybody is focused to, where they can deliver their best,
Yeah.
So there are some areas where you really find your interest, and I really find interest. It is so good. Like somebody is not mobile, and you can give him mobility by providing the better quality of life, and the results are very amazing and
Yeah.
very visible. It has inspired me since beginning when I was, started my uh, graduation. So I decided, no, this is the branch I am going to select.
So now that you guys are now working together, management, surgeon, it's hard to now differentiate, pick you guys away from each other. So
Right.
when did your professional journeys first intersect? Like when did
Yeah,
you
so
decide
I
you want
have
to?
once I have completed my post graduation,
Yeah.
then after I shifted to Delhi, and that's where I met Preeti, and that's where we have
Oh
started our
wow.
journey. Yeah,
At what
so
point did you both decide you want to work together to grow something together?
Actually, my interest has always been into management, and he is a very skilled orthopedic surgeon.
Yeah.
So we decided we can be more impactful. We can do something together and build something of our own, where both of us we contribute our own expertise and build something better.
Let's move away from the hospital. What are your personalities outside the
Mhm.
hospital? Let's hear from Dr. Preeti.
I'm you can say, when it comes to my personality, I have a very dynamic and versatile
Let's
personality.
hear it.
So I'm a mother of two, and I try to manage my home as well, and I try to be as professional as I can at my workplace. And I'm very dynamic. I like working a lot. If I don't work, I don't feel good. So that's, I'm always on top of every thing, every assignment. I want it to be completed in time.
Yeah.
So that's a part of my personality, and but I try to keep it fun all the time. Like
So, Dr. Rajiv, do doctors have a life outside the hospital?
Yeah, they do, but it's a very limited life because they're most of the time their profession
Yeah.
is require more time,
Yeah.
so the life is not too much. But yes, whenever you have a good company, whether your wife or you have a friend inside, then it's very easy to I have a good life. Yeah, so that's how it is. So Preeti bring a lot of spices to the my life, my boring life, I would say,
Yeah.
which is always as a doctor, always into profession and
Yeah.
thinking more about the patients, healthcare, improvement, and multiple other things. You focus more on learning and giving back to the society.
Oh,
So I
interesting.
mean, yeah. So
So
that's
who's
how it
more
balance. Yeah.
who is more optimistic?
Both are optimistic. Okay.
There should be someone that is more.
I would say it's
it is situational.
yeah,
Okay.
It
true,
is
true.
situational.
Yeah, both of us, balance the situation. Sometimes I have a good optimism, and when I'm down,
Yeah.
she motivates me. So
So
that's how we balance each
who
other.
makes the tougher decision?
She's very good in management skills. So yeah, I
Dr.
leave all
Rajiv is
those.
giving all the accolades to Dr. Preeti.
Yeah, that's the main person, behind all this
Yeah.
new startup. So I would say I could not have taken all these decisions alone.
Yeah.
I can take this decision on my part in my field, but when it comes to, like this
The
is all
management
teamwork,
aspect, yeah.
It's
Yeah.
not like one person is taking bigger decision. It's all combined decision. It's a teamwork.
So does
yeah.
being husband and wife make running a healthcare organization easier or more complicated?
It's a difficult question.
Yeah.
It's a difficult question. It
Mm.
has both the paths.
Oh.
It's complex as well as it's easy as well, because we understand each other, so it becomes easier. But it's complex at the same time, because we both are at work, so work-life balance become little tricky.
Yeah.
But then we are coping up well, so it's fine. So and as far as you have a very good compatibility, you have an understanding, you are not insecure in your spaces, you'll be fine.
Yeah. So how do you separate work from your family life?
It's after working hours, we try. I try to give more time to the other part, And whenever I am busy and I am more occupied at my work, he tries to manage and cover up that part.
Interesting. Thank you for letting us chip in to, the family life and all of that. Let's
Yeah.
get into some serious business.
Mm.
Many healthcare professionals are living in Nigeria. I'm sure you're aware.
Yeah.
And yet you choose to establish a specialist orthopedic center here. Why Nigeria?
As I said before, we have been here in Nigeria for quite some time. It's been many years, and every now and then we see patients who want to travel abroad for healthcare. Since it was destined, somehow we moved here and we started our thing here. But later on, we realized there is a lot of requirement of quality healthcare, and there's a gap. And a lot of patients, they always want to travel abroad for medical reasons and health purposes. We realize that we can fill in that gap. When we are in a position to provide quality healthcare, because our mission is to make orthopedic healthcare services accessible to as many people as possible. So we try to keep our things more accessible to more people, and so that we can provide the same kind of quality life, quality care, which people are looking, traveling abroad and getting it done there. If we can provide it here, close to your family support, where you don't have to go through the hustle and bustle of visas and all that travel, and everything is available here, and you can get the same kind of quality,
Attention.
then why not? So we wanted to build that gap. And also we realize here patients come a lot after delayed treatment. What they do is they will go here and there, they may not get the right treatment, the diagnosis is sometimes may not be as accurate, or so we wanted an accessible treatment hub here where anybody can come from Nigeria and get the right diagnosis, because we strongly believe in patient care, and we want to provide international standard care in terms of infection prevention, then also in terms of patient safety, and also we want to run as much as possible on evidence-based practice. So that's our motto. So we realize that a lot of doctors are moving, and here there's a lot of requirement, there's a lot of need. People are suffering every now and then. We see patients who are coming late for their treatment, who are coming with deformities or malunited bones and things. So we thought if we can be here, we can provide solution to that, and that will reduce the cost of their treatment, because delayed treatment leads to complications. It also leads to damage to the joints. So to reduce all of this, we decided.
So Dr.
we can
Rajiv, what opportunity do you see here that others are overlooking?
I think there is a very good scope of the healthcare, particularly orthopedic need in the country. Because see, the patients are suffering, they are in pain. I see many patients every day. They are having severe arthritis. They are having sports injury. They are having back pain. They are having deformities. And you will be surprised, like they are not aware. They think like the pain is a part of their life. If we see our elderly population, they are not aware there are solutions. Advanced arthritis treatment has revolutionized these days. It has evolved during the last few decades. The care is so good, like you have less pain, the good quality implants are there which can last longer, right? And the recovery is so fast, and you can walk very well after the treatment just next day or the same day. Because people think like, if you get the treatment done, particularly joint replacement, and you will be bound to the bed and you will not be able to walk again. So this is a myth is still in the society. So there is a big opportunity to treat the patient. There are patients who require care, but they are not aware. So we see this as is a big opportunity to help these patients, and that's why we are here to increase the awareness. Like there are solutions of their problem.
Thank you, Dr. Rajiv. Thank you, Dr. Priti. We'll be going for a quick break now. And when we return, we've talked about the opportunities that these doctors sees and why they are in Nigeria. When we return from the break. joining us. This has been Spotlight On, and I have two partners here, the Dr. Rajiv, Dr. Priti, and we've been talking about the opportunities they see in Nigeria that Nigerian doctors might not be seeing, or Nigerian patients might not be seeing, that make them fly abroad for, things they could have solved in their own country. So now I'll be asking, was there ever a moment you questioned your decision of ever being in Nigeria?
I can say initially when we moved, we were not very certain, because coming from another country, it takes a while to decide, are you going to spend more time here? Are you here for the rest of your life? So it's a very big decision. So we can't say it was a quick choice. But gradually, once we were in the system and we learned how people come and where we can make our own place and how we can impact more lives, how much is the need, how much we are able to help them. So it made our decision
quite slow,
not quite slow, but gradually progressing. So we became a little more confident, and over the years now our confidence is very strong. So now there are no more regrets.
So Dr. Rajiv, what has surprised you most about Nigerian healthcare environment?
I see, it remained, as I said, the awareness is lacking in terms of healthcare, and the people take long time before they present to the right clinician, because they try all different sorts of the medication, self-medication, sometime getting, not adequate treatment, not right diagnosis, right? So that remain very, difficult, right? At the time when they come, they present late, and sometimes they presented with multiple complications. And definitely providing the care at that point of time remain challenging. The outcomes are not as good as you present early, and you get right diagnosis and right treatment early on time.
So how difficult was it for you convincing patients to trust a new specialist institution? Because I think trust is one big issue.
So we are the new institution, I understand, but I am not new in Nigeria. I am working here since last 7 years.
Wow.
Okay, and I already have my own clients, so they are the one who follow me, rather than I need not to prove them. I am not new. My organization is new, and they believe this. Like, if I am working anywhere at any center, then I will definitely ensure the quality care, because all my clients know I don't compromise when it comes to the patient safety, giving them treatment,
Quality.
whatever is required for them to make it better, whether it's related to implants, whether it's related to anything which the patient need to get a best and quality care. It is our job to ensure like it has to be there.
So what were your biggest obstacle? You said you've been here since 7 years back. So what were your biggest obstacles during your early years?
Obstacle in terms of what?
Maybe the problem you faced when you came earlier.
I think earlier I was definitely walking. I have started walking, and I did not. It was definitely always challenge, as I said, like always, finding the right equipment in terms. Orthopedic is very demanding in terms of the equipment and all those things. So you have to get all good tools, right? Once that is set, that means your work get easier, because you require right tools, right setup, and everything to provide the good quality care. So that remain the initial hitches, initial problem, and once you sort out that, then everything is fine.
So Dr. Priti, if you had to start again today, would you still choose Nigeria?
I think yes.
Why?
I think yes. Because the way we have started, it's very encouraging. We see people coming and they are so glad, they are so happy. The gratitude they have for our services, it makes us very happy. Patient satisfaction is something, I'm telling you, once you have somebody who's very happy with your services, and when they come, that actually gives you a lot of happiness. And we are humans, we need happiness at the end of the day. So we are here since many years, so this doesn't feel like a different country to us. It's like a home for us.
Awesome.
So we are fine here, and we, even if given another option, we would start here because it's really good.
Okay, awesome. That's what I would like to hear because it takes me to my next question. Since we are discussing Nigeria as a home to all of us, let's discuss the bigger picture. Nigerians continue to lose billions of naira annually to medical tourism. Why do you think that's happening? Because is it problem of infrastructure? Is it the policy? Is it the confidence?
See, infrastructure is coming, infrastructure is there, but it's building gradually, and people are gaining confidence. If you, I don't know if you have these statistics, but if you compare, then more people now, they have started assessing care here within Nigeria.
Oh.
Like, apart from orthopedics itself, if you talk about oncology, there are big centers which have come up. So initially the care wasn't much available within Nigeria, but now there are a lot of hospitals have come up, and they are coming up with great infrastructure. So I am sure, and I am very strongly believing that slowly all this medical tourism will reduce up to a large extent, the way it is growing.
Just like you've said now, so many people are arguing that many procedures performed abroad can already be done here locally. So is a problem now a perception problem rather than the capacity problem?
So see, perception shift gradually, right?
Yeah.
When the people meet the right environment, right people get the right treatment done, they get recovery. Then the other understand gradually with the word of mouth, like there is a shift is happening, which is called reverse medical tourism. And the Nigeria is approaching towards it in many fields. I would so orthopedics is one of the branch where there is a bigger shift is coming. Right? Earlier, many people used to travel abroad just for joint replacement surgery. But I am now, because I am here since last 7-10 years, and I have seen once a joint replacement start, then after certain period of time, they need a revision joint replacement, right? So I am seeing the people are not traveling abroad for all these things, and they are coming back to you. So there is a big shift is happening, but all this is a gradual process. When your quality care improves, your management is also remain very supportive in managing all those things. So I would say it's a gradual shift, and it is happening.
Do you think the leaders are part of the problem? Like, how much responsibility lies with the government to enable the shift?
I would say government always, have their own limitations, like what they can do, but always these are the management people in the hospital and the doctors around. They need to put their demand forward. They need to meet, and they need to organize, because I know the hospitals are well equipped. They are. If I see the National Hospital, Ibadan Teaching Hospital, and their big surgeries are going on there. It's not so. Even they organizes conferences and everything, right? So government is definitely supporting them, and they are also helping to equip the hospital, providing the right implant and all. So it's not so like, everything shift gradually, Yeah.
But do you think Nigerians hospital, do they collaborate enough, or is competition a problem for us?
No, they are having collaboration gradually, because I have seen when I am in different organization earlier. So whenever you have a deficiency of a particular branch, right, you always collaborate. You call people, they come, and not like in healthcare, there is always a team approach. One person cannot do everything, right? Like suppose I have my own specialty, right? Joint replacement, sports medicine, and complex trauma. When it comes to the different specialty, definitely I do collaboration with the other different colleagues, and they come. So it's all team approach, and we are all understanding that concept. So and it is happening. It is happening.
That's good to hear, Dr. Priti, do you think healthcare should be treated more as a public service or as a business?
See, for now, if you talk about private setup, so there need to be, specifically talking about private setup, there need to be a balance between public service and how you treat it as a business. Healthcare is not something which you can treat as a business. No, it's not ethical, And that's not how it should be. Every person should have a right to the right care. But yeah, because it's a business, so you can't run at loss. You can't, because every business, it needs funding. So you need that money to keep it running.
Yeah.
So that business can't be detached from it. But yes, it is something which everyone should have an access to. So it more falls on public as well as private partnerships. Like if they come and collaborate to each other, I think it can be made more accessible to as many people as possible.
Yeah, so it's very good question, like whether it's a business, whether
Yeah.
you carry social responsibility, right?
Of course.
Yeah, somebody should not be devoid of a particular treatment because he's short of money, right? So always organization look at it at different perspective, how they can create a balance so that they can treat those who require care, but they not up to that financial aspect is not, supported by somebody. So, I mean, there are different ways like NGOs, other people, sponsors, right? And sometimes organization, like we also think about it and we also run some camp and we also run our services at the discounted price. So, whatever a particular cost of the treatment to run the organization, right?
Yeah.
And then many a time we think about it like how we can help those people who require care but financially yet not prepared. So like we receive clients every day, right? We always have their details and we keep checking with them like how they are doing. And if we come to know like there are 10 of our patients are not able to get treatment because they have not reached to that limit, so we organize to run a camp. We give them a major discount so that they can also avail care. So
Since
that is, like that's how you create a balance
Yeah.
between a business and your social responsibility.
Since we're talking about money, let's talk about affordability of private hospital, because we've mentioned that so many patients, come late when the situation is worse. Don't you think this is as a result of the notion that private hospital are expensive? Many Nigerians believe quality healthcare is only available to those who can afford it. Is that criticism fair enough?
Actually, that is a cycle, is like a vicious cycle. If you are not able to afford early, right, and you try to get the care later on, it becomes more expensive,
Yeah.
more challenging, outcome becomes more difficult, right? You may not get a desired outcome. Rather than if you try to understand and come for the treatment early, right? Your diagnostic test may not require that much, like,
Yeah.
you can easily diagnose with the help of x-rays or small imaging modalities like ultrasound. Later on, if you present late, you have to go for CT scan, you have to do MRI. That is already increasing cost of your care, right? So this is a very
So,
difficult situation.
yeah, it is, because
Yeah.
Dr. Pate, how do you balance
Mm,
financial
mm.
sustainability with patients' care?
See, like as Dr. Kumar said, we recently organized a camp and we gave free consultations to all of them. We gave them subsidized cost of investigations, highly subsidized cost. So wherever possible, we do that. Like currently also, we are running a knee and hip replacement camp, which is available at almost 25% lower than the routine
Oh,
regular
that's huge.
prices. So that is a part of our CSR, which we do. We want everybody to access the care, but wherever we have patients who are complex, so where the surgeries, because itself, if you see about the equipments and the cost which is there in the establishing an orthopedic center or any healthcare sector, it's high. Like healthcare is a highly capital intensive industry, so somehow you have to keep balance of that as well. So wherever it is possible, we do that. We do free consultations, we do camps, and we reduce the margins to minimum wherever we can, if we know it is a right candidate. And that's how I believe all the organizations should be. The more private organizations can also think in the same respect, reducing the prices or keeping the margins low so that people can have more access. Rather than having one patient, you can have 100 patients who can afford more, and you are doing good to everyone. So it gives you an inner peace as well.
Thank you so much, Dr. Priti, for that insights. We've been talking about affordability and healthcare. But when we return, the conversation continue because we'll be having practical conversation, because I think this is one of our major problem, affordability of private hospital. That's what chase people away. They think they can afford it. Oh, especially from foreigners, the mindset that this would be very expensive. We'll be going for another break now. And when we return, we continue the conversation. Welcome back. If you're just joining us, this has been Spotlight On, and we've been talking about one of our major problems when it comes to healthcare, affordability. The cost is one of our major problems in Nigeria. How do healthcare personnel balance affordability and taking care of, balance putting together the hospital, keeping it alive and maintaining the quality health of the patient? So let me ask Dr. Rajiv, have you ever had to treat someone who genuinely couldn't pay?
That situation I have not faced till now, because most of the patient, whenever they come for the consultation, the help we provide, if they have a challenge of making, initially consulting, we waive off many a time their consultation prices, so that at least they can understand what the problem is, right? Because the treatment becomes, once you consult, right, then the treatment option comes. And definitely we are still very new, and to run the business we have to also sustain, right?
Yeah.
So we have to see into that, but in long term we also see, like, if we can associate with some NGOs, with some sponsors, like, so that those patients who are coming, and the treatment is a basic need,
Yeah.
it is a requirement, and it has to be fulfilled with the help of maybe organization. Maybe we also try to provide the treatment at a lesser cost, which we are already trying at our end.
Yeah.
But we are too new, I mean, to just waive off the complete price and then put ourselves
I
into
think
trouble, like
Dr.
we cannot
I
run the
think Dr.
organization.
Kumar is forgetting
Yeah.
he has done that.
Really?
Because
Okay.
he's not the one who takes care of the the payments and
Financial
all.
aspect, yeah.
So
Okay, he
we
just
have
had to
done,
treat.
yes, we
Yeah.
have done that. We've had patients, whom he have treated, and they want to come and see him, and they don't have a tie-up, because now health insurance is also one of the
Yeah,
upcoming thing. But somewhere, somebody is not having access or care, so we have waived off the consultations. As I said, free consultations we have done a lot, and there have been patients who could not pay. So, but so far it has not been a major surgery which we have waived
Yeah.
off completely, but minor treatments we
Minor
have done
issues.
free of cost as well.
So what ethical dilemmas arise when medicine meets business?
Ethical dilemma is always there, but at Paris, we don't compromise with that. For us, patient safety is first. If we have committed a patient, this is what we are going to do, irrespective of the bill. If it goes beyond, if we are spending more, it doesn't matter, because what we have committed, what we have said, what we have agreed, we want to do the right thing. We don't compromise on quality. We don't compromise on ways of infection control. We don't, and our journey is not only limited to surgery, it's beyond that. So anything related to prevention, patient awareness, which we are big on, we go out a lot and we give more of awareness talks, because that's our motto. Rather than looking for patients for surgery, we should prevent that. So we take care of that, and even after surgery into rehabilitation. So that is our larger goal, to establish a complete orthopedic center of excellence, which provides from beginning till end, till rehabilitation, and all of that
So you've
together.
mentioned health insurance. Health insurance penetration remains very low in Nigeria. Why has it failed to reach more people?
It is gradually picking up. Like if you see the data, how many people had health insurance before and how many you have now. Like when we started working, more of the hospitals, like the private out of pocket expense was higher than what it used to be from the HMOs and corporate retainers. But gradually over these years, like last 5 to 7 years, what we have realized is that the number of HMO and insurance patients have increased drastically. So it has now outnumbered the patients who are coming or who are spending out of pocket.
What reforms do you think would make healthcare more accessible in Nigeria?
As you mentioned, like more medical insurance. If the more insurance companies, more support for the patient,
Yeah.
and subsidize treatment available, and how we can make the treatment affordable. That is a major question. Because if you look at the healthcare, everything is imported,
Yeah.
right? Manufacturing. If we talk in terms of the manufacturing, how many medical equipment manufacturing companies we have locally in Nigeria? I think the future is there when we have more companies which are manufacturing locally, all implant equipment, all healthcare related things. If getting manufactured here, treatment will be more accessible for each and everybody. Hospital cost will go down, patient will be more free, insurance companies will come more, because the right now if you see the whatever treatment cost here, maybe I don't know how the insurance companies look into in terms of the business, right? And also the people priority, patient priority, the healthcare gradually develop. We were also, if you look at India 15 years before, they were like this. The health insurance coverage was not that much as you see now. So it's a gradual process. I think is a multidisciplinary team approach where the government, organizations, companies, infrastructure, manufacturing, everything has to come together to support the healthcare, because healthcare is a combination of everything.
It's very relevant.
Yeah.
So moving away from patient-doctor relationship, let's talk about building a hospital itself. When I talk about building a hospital, I'm talking about the people. A hospital is only as strong as its people. So how difficult is it for you finding and retaining skilled professionals?
If you give them the right environment, I believe people stay. Why people leave is not because they don't like the job. It's mostly they don't like the bosses, if you see. So, you have to give them the right set of environment. People here, and I'm honestly speaking, I have seen people who are very smart. They're very intelligent. They're very competitive. They have a high potential of learning. So we need to provide the right kind of training, right kind of environment, rather than, a toxic environment should not be there. The right set of environment will actually bring up the best of the people who actually run the hospital.
Yeah. So with the numbers of doctors leaving the country, how are you finding the brain drain? Is it affecting your work?
It does.
It does.
It does, because a lot of doctors and a lot of nurses, they have been moving out. So, retaining people, it becomes difficult. But still, I would say there are a lot of people who are still waiting here, who are still dedicated, who still believe in the healthcare system in Nigeria. So they are still there.
Dr. Rajiv, you want to say?
I would say people always opt for a easier path, like go to a place where everything is well established and you have to deliver only your services. That is the easiest way, I think, right? And that's how you opt to. But if you think a bigger picture, right, where there are opportunities, you have a freedom of work, you have a accessibility to reach more and more people who really need your help. So the thing is this, just changing your brain, getting that concept, like you want to help as many people who are your own people. I think once you reach to that, and definitely destiny will help you. People will come together. See, it's not so like the people don't have money, right? They also want to look into if they put the money, how it will be utilized, whether they use it rightly or not, right? Why not the investors should invest more into healthcare, which is
Yeah.
highly required,
Yeah.
develop more number of hospital, or which are the presently they are hospital, equip them, bring skillful people there, right? Pay them well, not like the hospital. Why doctors leave? Because whether they are not well treated, nothing is being done for them for their proper training, right? And they don't get that kind of environment where they can deliver their best,
Yes. Yeah.
right?
So
So
they feel
that's
like
the
they
reason
waste.
they just think like, okay, let's go to a place, So I mean, it will take time. Definitely, people will think about it, and thing will change. It will take time.
But how do you maintain standard under pressure? Because I think Nigerian healthcare system, there's a lot of pressure. How do you maintain standard?
So you have to be always on top of everything. You cannot ignore anything when it comes to the patient care, whether it comes to the pre-operative planning. You have to ensure like you have everything to do your case, right? And you cannot just leave it like, okay, because there are people like it's not so like they do not want to help or they don't want to do, but sometimes they have their limitation, right? And they need repeatedly supervising them, then there was a time come when they will be independently able to do it. So is a process establishment. So
Do you
yeah.
think excellent patient care can be taught, or is it a mindset for people?
Yeah, it comes gradually. I mean, it's a very good question and difficult to answer
Yes,
as well.
Mr. Rajiv, everything
Because
comes gradually.
excellence, see, nobody is excellent. If I say,
Yeah.
am I excellent? I don't know, right? But definitely is a thinking, right? Every day you try to become better, better, and better. But if you just ignore few things, no, this is like this only, and this is not going to change, then nothing is going to change. So you should have a mindset, definitely, because excellence is a mindset, nothing else. You have to gradually change something every day to deliver better.
Yeah. So, Dr. Priti, what leadership lessons have you learned from building Paris Orthocare?
One thing which I have understood is that to be a good leader, as Dr. Kumar said, you have to be on top of everything. And I believe in upskilling the staff. I don't believe in, doing everything and not considering staff. So I want to be of that leadership model, that wherein we are very employee friendly, and we want to empower and upskill our staff.
Yeah.
Because people have potential. As you asked about mindset, not everybody, yes, there are people who don't want to work, but there are more people who want to work. It's just that they don't get the right environment. So we believe highly in training the staff. So that's what, however, we have just started, but we always keep on, improving what all courses they can do and how they can improve on their own skills.
Yeah.
They are with us or they move to another organization. It's okay, but they should gain something when they are working with us.
With you. Yes. Thank you so much. This has been a very interesting conversation. Having the last time, my last conversation was with a Nigerian medical doctor, an angry Nigerian medical doctor. So now I'm talking to medical doctors, very positive medical doctors from another. So we'll be going for a quick break, and when we return, we'll be rounding up with our final segment, the rapid fire. Welcome back. If you're just joining us, we have been on Spotlight On with my interested guest, and we are just on the final segment. It's called the Rapid Fire, where you are allowed to just say one word, no further explanation. So since we are having both of you, it will be a competition. The person who can mention the first, who can answer first. So one word that describes Nigeria's healthcare system.
Growing.
Growing. Okay, Dr. Priti. One healthcare reform Nigeria cannot delay.
I'm giving him chance.
No, you don't have to.
You can win.
One healthcare reform Nigerian cannot delay.
More insurance.
Okay. Public healthcare or private healthcare?
Public.
Are you serious?
It should grow more. It needs more.
Yeah, it need more.
See,
Awesome.
not public. It should be more public.
All right.
However, we are from private, but
Yeah.
it should be more
More
public.
public. Yeah.
Innovation or experience?
Innovations.
Okay. Technology or human touch?
Human touch.
Leadership or expertise?
Both.
It's both.
It can be both. It has to be one. One has to be
Expertise is
ahead.
okay. Yeah. If you
Expertise.
cannot control leadership, then you have to be
Yeah.
work on expertise.
Okay, so work-life balance, is it possible?
Difficult, not possible.
Okay, some people would have said it's possible, but medical doctors, oh God. The biggest myth about orthopedic surgery.
You can't walk.
Oh, interesting. So one habit every Nigerian should adopt for healthier bones and joint.
Walk more.
I should be expecting that. Okay, one word that describes your partner.
Supportive.
Okay, Dr. Rajiv, let's give you a chance. One word that describes your partner.
The same word I should say.
Thank you so much, Dr. Priti Chawhan, Dr. Rajiv Kumar. Thank you so much for joining us on Spotlight On. Today's conversation reminds us that healthcare is about far more than hospitals and operating theaters. It is about trust. It is about access, innovation, leadership, and the difficult choices required to build a system that truly serve people. As Nigeria continues to confront the challenges of healthcare delivery, conversations like this matter, not because they offer easy answers, but because they challenge us to ask better questions about the future of medicine, the role of private enterprise, and the standard patients should expect. I am Zainab Ibrahim. Thank you for watching Spotlight on S24 television. Have a lovely day.